So oftentimes our patients ask, what do we take with us to the hospital? So we'll be going over a list of what the nurses here at PRMA recommend you take. The first thing we recommend is that you take slippers and a robe. The robe is very important because the hospital can sometimes be a cold place and hospital gowns don't cover your backside when you're up and walking. You also should take slippers so that your feet stay warm, and they should have a non-skid surface so you're not tripping and falling as you're walking around. We also recommend that you take a pillow. The pillow is important for the ride home, so there's something to go between you and the seat belt. That way there's no digging into your breast or your abdomen if there are sharp turns, potholes, anything that could potentially constrict that seatbelt on top of you. Also, there's no pillow as comfortable as your own pillow. Sleeping in the hospital is very uncomfortable, so we definitely recommend you take your own pillow from home. Just make sure you don't put it in a white pillowcase. Make sure it's something bright and fun. We also recommend that you take earplugs and an eye mask. The earplugs are really important because the hospital is a 24/7 operation. There will be people walking around constantly, call lights, call bells going on. It's a very noisy place. We also recommend that you take an eye mask because even if the lights in your room are off, the lights in the hallway are on and they can be quite bright. For hygiene-wise, you will not get a shower until usually the day that you're going home. For some ladies, it can be 2 or 3 days. Some ladies, it can be as many as 5. During that time, you definitely will want to wash your face, wipe down your body. So we recommend taking face wipes, body wipes, also using Colgate Wisps. They're a wonderful little invention that have a little bit of toothpaste on them, and you can brush your teeth while you're sitting right there in the bed and not having to worry about rinsing or spitting or anything gross like that. If you do wear contacts or glasses, we recommend that you take only your glasses to the hospital, not necessarily the day of surgery, but have somebody bring them to you. Glasses are notorious for getting lost while you're in the hospital. If you give them to a well-meaning nurse or doctor, they could very well end up in the laundry. So we recommend somebody else brings them in an overnight bag. You will not feel up to putting contacts on, so make sure that you do have a fresh prescription of glasses that you can use so you can see the world. We do recommend that you take a t-shirt. The t-shirt is very important so that when you are able to shower, you can put the t-shirt on first and then put your surgical bra and or binder on top of it. That way it reduces irritation to your skin. One thing that's very important you take with you is entertainment. Most ladies find that their mental recovery is a lot faster than their physical recovery, so having something that keeps your mind entertained is key. You should take books, laptops so you can watch movies, play video games. Just remember that you are not the entertainment. If you have multiple visitors coming and seeing you, that is perfectly fine. Laughter really can be the best medicine, but just remember you are not there to entertain everybody. They are there to entertain you. You also need to have a really good support system. Following surgery, we do recommend that somebody is home with you 24/7 for the first 1 to 2 weeks once you get out of the hospital. If you don't have a good support system, please let your nurse know, and we can definitely work with you to help you find somebody who can take care of you after surgery. Most important thing you can take to the hospital is a positive attitude. Most ladies who go into this surgery are absolutely terrified because they have breast cancer and they're having a major surgery. It is a life-changing surgery. However, if you go into it with a positive attitude, knowing that you are in really great hands, our physicians are just phenomenal, you will come out of this surgery doing well. Having a positive attitude will also help your recovery. You will recover faster, you will be on the mend, you will be able to return to work, and if you don't work, your housework, your normal daily activities sooner than patients who are woe is me and don't want to get out of bed.